Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we will be talking about the National Healthcare Safety Network's updated definitions for COVID-19 vaccine reporting. Everyone will be on mute, but we will be doing a question and answer session. So please drop in your questions or comments using either the Zoom chat or the Q&A feature. We encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we will be talking about NHSN's pathway reporting. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Deborah Wright. Deborah is a quality improvement specialist at Quality Insights. She joined our team after being in the long-term care industry for more than 30 years. She has a wealth of experience in long-term care nursing and management, ranging from certified nursing assistant to vice president of healthcare operations. She is most passionate when working with the MDS process and quality improvement. Deborah, welcome and thank you for joining us today to talk about updates to COVID-19 vaccine reporting.
Thanks, Kathy.
So to get started, there seems to be a lot of changes to the wording in the updated reporting requirements. Could you explain what primary vaccine series, booster dose, additional dose, and up-to-date mean?
Sure. So there has been a lot of confusion recently, simply because we've had the regulations updated with the definitions, but NHSN recently came out and said these are the new definitions for reporting. And some of that is because they follow a quarter and they won't make the changes to their reporting a requirement until the new quarter starts. So the most common one, obviously, is the primary vaccine series, which is defined as the 2-series dose of the mRNA COVID-19 vaccine, which we know as Pfizer and Moderna, or a single dose of the Janssen or the J&J COVID-19 vaccine. Then the second common is the booster dose. So the booster is defined as the subsequent dose of the vaccine administered to enhance or restore the protection which might have waned over time after the primary series vaccination. A little less common and not captured as often because you need additional documentation is the additional dose. So the additional dose is defined as another dose of the vaccine administered to people who were less likely to mount a protective immune response after their initial vaccination, such as those who were moderately or severely immunocompromised. But for purposes of reporting, unless you have specific documentation that an individual received that additional dose, you need to assume that it's a booster dose. So unless you have documentation and proof that it should be counted as an additional dose, you need to assume that it's a booster dose. So as I said in the beginning, even though changes to the vaccine requirements change at any given time, NHSN follows the same definition for an entire quarter. So as of June 27th, for quarter 3 of NHSN reporting, up to date is defined in 2 categories based on the individual age. So first, you had the category of individuals that are under 50 years old, which is probably going to include the majority of your staff, and it's a bit easier to track. So if you have an individual that's under 50 years of age, they need to have received at least 1 booster dose or recently received all recommended doses in the primary vaccine series, but is not yet eligible for that booster dose. So as we said, that includes those that completed their 2-dose primary series of the Pfizer or the Moderna, and the time frame for that is less than 5 months ago. If you received the Johnson & Johnson, then it's less than 2 months ago. So again, the first category is you're under 50, you received your primary series, and you're either not eligible for a booster, or it's been 5 months since you've completed your primary series and you've received 1 booster dose. So if you've met that criteria, then you're up to date if you're under 50. If you're over 50, this is where it gets a little bit more harder to track, and they really are looking at it from a literal point of view. So you're over 50 years of age, you've received your primary vaccine series, it's less than 5 months ago, you're done. If it's over 5 months ago for the Pfizer or the Moderna, you have received your first booster dose. And then after you receive that first booster dose, if it's less than 4 months, you're up to date. If it's over 4 months, then you're no longer up to date. So again, you have to have your primary series. If it's over 5 months from your primary series of the Pfizer and Moderna, you have received a booster dose. And then 4 months goes by and you get a second booster dose. If it's Johnson & Johnson, it's the 2 months, your primary series, 2 months, your booster, and then the 4 months and a second booster. So that gets a little bit more tricky to really manage your dates. I recommend that you use the event level reporting that's on NHSN, because it does help calculate where an individual would be falling into their reporting. The only other thing that they hit upon again was the moderately to severely immunocompromising conditions. So those cases, you've received an additional dose less than 3 months ago if the primary series was Pfizer or Moderna, or you received an additional dose less than 2 months ago if it was the Johnson & Johnson, and you've received an additional dose and 1 booster less than 4 months ago, or you've received the second booster. So as many of you know, Quality Insights receives assignments from CMS to reach out to nursing homes that have a resident booster rate less than 75%. What we're starting to see that is, as nursing homes are fully understanding these definitions, their booster rate can take a dramatic drop from week to week. For example, if you had a booster clinic and the majority of your residents received their first booster, and now it's 4 months and 1 day, technically they're no longer up to date. So depending on when you have your next vaccine clinic and when you're doing your weekly reporting, this could really have a big impact on your reporting and your resident booster rates. So, I say that so that you're not surprised if we reach out to you, and together, we can work together to ensure you understand the definitions and help you plan your next vaccine clinic date so that you can keep the resident booster numbers up to date. So with that, before we go into the next step, does anybody have any questions on what is up to date?
So we already have a couple questions, and I'll read those off to you in a moment. If anyone else also has questions, go ahead and start dropping those into the chat. And in a moment, I will also be sharing my screen so we can have that schedule from the NHSN that Deb was discussing on our screen while we go over some scenario examples. So Deb, our first question, do you know when the second booster may be available for those under 50 who work in healthcare?
I have not heard specifically when that's available, depending on your pharmacy. I do know of some people that have gone to the pharmacy and say, look, I'm late 40s, I work in healthcare, I work with COVID individuals, and some pharmacists will take that as though you're compromised and at higher risk and will give you that second booster. But there is nothing in writing and no recommendations for under 50 to have a second booster at this time.
All right, the second question, is there a way to print the event level report and utilize that report to show which staff or residents that would be eligible for which dose at which time?
I do not think that there is, but if there's anybody on the call that does know how to do that, please feel free to drop that in the chat and we can help each other with this. But I don't think that there is, and I know that that is why some people use their own, because they, the color coding and highlighting and drawing attention to when their staff or residents are due is a feature that they like. So there are pros and cons to the event level report. And I think that obviously the biggest pro is that it calculates what you need to code in the NHSN reporting module. So I know that really didn't help that person, but maybe there's somebody on the call that has a better answer for that.
Yeah. And we'll have another second quick Q&A once we're done with this example scenario session that we're going to do next. So if you do have more questions, keep dropping them into the chat. And also, Deb, do you want us to go ahead and say if people have other topics that they want us to discuss in future webinars, please drop that into the chat too. We would like to see if there's any particular themes or topics that you want us to cover in the future.
Sure.
And
so as Kathy gets ready to start the polling, we're going to move on to some resident and staff scenarios and see how you would interpret their vaccine status. These examples are straight from the NHSN examples. So if you participated in their recent trainings, they're going to look familiar to you, but I don't know about you. I need to see it and have time to talk about it. So with that being said, if we do an example and you don't understand the answer, please raise your hand or put your question in the chat, because we want to take this time to make sure that you completely understand the term so that your reporting is as accurate as it can be. And like I said last week, when we did the polling, we are recording this for future use. So I will read, even though you can see it on your screen, I'm still going to read it in its entirety so that it can be recorded. Also, Kathy is going to, let me see here if I can see it. Okay, Kathy is going to put up the table that I summarized for if 50 years, if under 50 years and if over 50 years, so that you can use it as a reference. I highly recommend that you find this in the NHSN manual, print it, make a copy of it, put it right where you track, because I find myself looking at it all the time when I'm looking at the reporting, and it's the only way to keep myself straight. So, feel free to do that in what helps you.
yeah, and I'd like to add that I linked to this PDF that I have on my screen right now. It is in the link in the chat. I think it's the first one that I dropped in the chat. And if anyone is listening to a recorded version of this afterwards, either on YouTube or on our podcast, I will include the link to this document in the description of that episode. And now I think, are you ready to start the poll, Deb?
Yep, sure.
All right. So let's see, I'm going to click launch, and I think it actually might show all the questions at once. Or I did it a different way than last time. Do you see all the questions this time?
I do, yes.
Okay. Well, we're
So
going to
are we going to
time.
Can we get the answers to one at a time, or do we have to do them all and then get all the answers?
I thought we could do them one at a time, but it looks like we might have to do them all at once, or rather see the results at the end all at once.
Okay. All right. So what we'll do is we'll read the question. We'll give you a little bit of time to answer, and then I'll tell you what the answer is. And then if you have questions regarding the answer, like I said, feel free to raise your hand or put your question in the chat, and we'll stop and go back.
Yeah.
So the first one is Bill is 65 years old. He received 2 doses of the Moderna COVID-19 vaccine for his primary vaccine series. He later received 2 booster doses of the Moderna. Second booster was 5 months ago. Is Bill considered up to date? So in that instance, yes, Bill is up to date with the COVID-19 vaccine because he received 2 boosters. So the second question, Anne is 20 years old. She received 2 doses of the Moderna COVID-19 vaccine. Last dose was 7 months ago. She has not received any booster doses. Is Anne considered up to date?
Sorry, I just realized I'm muted. I should mention that these polls are anonymous. It's not going to show what people answered. So far, my screen is showing that 0% have participated. So we really encourage you all to answer yes or no, just so we can sort of get a gauge on the pulse of how we understand this. Okay, I'm starting to see some people answer now.
Okay, so again, Anne is 20 years old, 2 doses of the Moderna. Last dose was 7 months ago, and she's not received any boosters. Is Anne considered up to date? In this instance, no, Anne is not up to date because she has not received a booster dose, even though she's eligible for it. So remember, Anne is under 50 years old, so she only needs 1 booster dose to be considered up to date, and it has to be after 5 months. So the next one is Mary is 35 years old. She received 2 primary series doses of Moderna COVID-19 vaccine, and she received 1 dose of the Moderna COVID-19 vaccine 2 months ago. Is Mary considered up to date? And I think since we're doing it this way, Kathy, if you just want to let me know when it's okay to give the answer, that'd be helpful.
Okay, that sounds good. I do think though now that it might not be showing us as people have participated until they've completely finished the quiz. So I'm sorry I did it this way. I thought it would let us do it one at a time. So we know next time I'll structure it differently where they're not folded into the same
Okay.
quiz.
All right, no worries.
Yeah.
So in this instance, yes, Mary is up to date with the COVID-19 because she's less than 50 and she received the 1 booster dose. So the next one, Tom is 60 years old. He received 2 doses of the Pfizer COVID-19 vaccine and 1 booster dose of the Moderna vaccine 4.5 months ago. Is Tom considered up to date?
This one we're starting to get results in. So maybe people are turning them in, starting to finish up their quizzes. This result, people were almost half and half. About half said yes, about half said no. A little more, fewer people said no than yes.
Okay, so the answer is no. Tom is not up to date with COVID-19 because he's 60 years old, greater than 50, and received only 1 booster 4.5 months ago. Since it's been more than 4 months since his booster, Tom is now eligible for a second booster, but has not received it. And that's where the system is, when I said earlier, the system is literal. If it has been 4 months and 1 day, they are no longer considered up to date. So there's that potential for that a week or two for you to go from 100% of being up to date to 0% up to date, depending on when you have your vaccine clinic scheduled for. So the next one is Jackie is 78 years old. She has received 2 doses of the Moderna vaccine and 2 booster doses of the Moderna vaccine. Is Jackie considered up to date?
So most people, actually all people answered yes for this.
That's correct. Yes, Jackie is up to date because she received 2 booster doses. So the next one, John is 23 years old. He received 2 doses of Moderna and his last dose was 3 months ago. Is John considered up to date?
For this one, everyone also was unanimous. Everybody said yes.
Well, I would agree with that. John is, I'm looking at the NHSN answers and they are saying no, John is not up to date because he has not received a booster dose, even though he is eligible. It has been over 5 months. So I'm thinking there must be a typo in there. So we're gonna skip that one. The answer should be yes, he is up to date. Frank is 70 years old. He received 2 doses of the Pfizer vaccine, with the last dose being given 3 months ago. Is Frank considered up to date?
For this one, most people answered yes.
That's correct. So Frank is up to date. It's been 3 months since he received his second dose of the Pfizer vaccine. Therefore, he's not eligible for the booster. But remember, once he becomes eligible, it'll be after 5 months from his last dose. Jane is 19 years old. She only received the first dose of the Pfizer vaccine. Is Jane considered up to date?
For this one, everyone answered no.
Right, because since she had the Pfizer, a Pfizer is a 2 series, and so she has not completed her primary vaccine series. So no, she is not up to date. And then the last one, Alice received 2 doses of the Moderna vaccine. She received an additional dose 1 month ago due to having a moderately immunocompromising condition. She has not received any booster doses yet. Is Alice considered up to date?
This one was a little closer. About 2/3 of the people said yes, and about 1/3 said no.
So the answer is yes. Alice is up to date with her COVID-19 vaccines because she received an additional dose 1 month ago, which is less than 3 months ago. Therefore, Alice is not eligible for a booster and will be eligible once it's 3 months from her additional dose. So now that we have reviewed the questions and the answers, does anybody have any questions regarding the answers that corresponded with the questions? So while we're waiting just a little bit to talk about the session for next week, we're gonna try to basically do the same thing that we did today, but we're gonna do it with the pathways. And we're gonna look at the manual right from NHSN. We're gonna take their examples and we're going to do them so it's one question at a time, and so that we can talk through each one. And some of the examples will be the same, but it'll add into account if they've been positive for COVID, what time was their test, how far back was their positive test versus their vaccinations, and see how you would code everything in the pathway modules. And like Kathy said, if there's any additional topics that you'd like us to cover in the following weeks, please feel free to drop that in the chat or email Kathy or one of our team members, and we'll be happy to get that added to the agenda.
So I'm leaving the poll up a little bit longer just in case anyone else had any clarifications that they wanted on the poll that we did today. Looks like we had pretty good participation in this. Thank you so much for answering those questions. I don't see anything else in the chat so far. Just so everyone knows, I put my email in the chat along with Deb's email in the chat in case you need to get in touch with one of us following this webinar.
I did notice that there's a question. Did you see that? Somebody asked, what is the time frame for boosters again? Is it 4 or 5 months?
Oh, is that in a different, let me check.
Yeah, it's under the Q&A.
I forgot to check the Q&A. Got very many windows up. So let's take a look at that. Yes. Okay. So Deb, that question was.
Yeah, I have to find it. I somehow lost mine. So just give me 1 second to pull it back up.
Yeah, the time frame for boosters, is it 4 or 5 months? I think maybe the confusion could be if you're going from the vaccine series to the second booster. If you've had the Moderna or the Pfizer vaccine, and you're going for your first booster.
So the
one,
first,
yes,
the
at 5
first
months.
booster is 5 months. The
Mhm.
second booster is 4 months. So you've received, if we're talking about Pfizer and Moderna, you've received your primary series. 5 months have gone by. It's now time for your first booster. Once you received your first booster, then 4 months go by and it's time for your second booster. And the timing of all that is the same for Johnson & Johnson. It's just that after your single dose of the J&J vaccine, you wait 2 months and then you're eligible for your first booster. And then it's again the 4 months for the second booster. If that did not answer that person's question, please let us know.
All right, so I don't see any more questions coming into the Q&A, and I don't see any more questions coming up in the chat. If it's all right, I would like to go ahead. Is it all right if I go ahead and wrap up?
Yep, that's fine. If there's no
Okay.
other questions.
Yeah. I'll check one more time before we take off. Okay. So I would like to again remind everyone that our next webinar will be on NHSN pathway reporting. That will be next Wednesday at 2 p.m. We also host office hours live chats twice a week where you can drop in and get one-on-one advice for your facility from one of our quality improvement specialists like Deb. Those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. You can find the links to those live chats and our webinars in the newsletter we send out each Friday called the Last Minute Lowdown. If you would like to receive that newsletter but don't think you are on our mailing list, you can email me and I will get you on the list, and you will find my email in the chat. And you can also email me if you would like a recording of today's webinar. If you want to contact Deborah directly, you can reach her at 1-800-642-8686 and enter extension 7636. You can also email her at dwight@qualityinsights.org. That's DWRIGHT@qualityinsights.org. And you can check out our other interviews by visiting qualityinsights.org/QIN/multimedia. I will take one more look at the chat before we take off here. Make sure we don't have anything else. I lost my window though. Here we go. Okay, I don't see anything else in the chat. And I do not see anything else in the Q&A. So I would like to thank all of you for joining us today. And Deborah, thank you for joining us today.
Thank you.